So when a patient gets seizures in the antenatal care, usually that is not very common. You can evaluate the patient and you should exclude other causes, especially cortical sinus venous thrombosis. And of course, eclampsia is one thing which, if it is in the third trimester, and other things is PRESS and RCVS. I'll tell you what is PRESS and RCVS because it is the latest concept which is, we see so many patients, especially because of so many complications. So if any patient comes with a seizure, always try to give monotherapy, but not at the expense of seizures. And if the patient's seizures are still not controlled, you can give polytherapy, but we should always remember that. So if any patient who becomes unexpectedly, pregnant, who is on epileptic drugs, they should not stop the drugs. This is very, very important message which should be done in the counseling. Most of the doctors, they don't spend time in counseling the patients. I think we should always talk to the patient, and we should, we talk to the patient individually also. Sometimes we see they don't reveal it to even to the husband or to the in-laws because of the fear of divorce and other issues, because they may be having seizures from long time, they may be taking the drugs and they don't reveal it. I have so many patients who don't reveal still even after the marriage to the family. That's very important. We have to counsel both the parents and the family. And suppose if you are taking drugs, always better you give monotherapy, smaller doses, or extended release to avoid high peak levels. That is the most important things. So previously monitoring anti-epileptic drugs is it's a compulsion, but now it is not there. There is no need of monitoring routine drugs unless you have a doubt whether the patient is taking drugs properly, or if the patient is on polypharmacy, where sometimes one drug to another drug, they can cause, they can influence the levels of the drugs. So the commonest now, the life has become easy because of now the safer drugs which have least interaction have come. Among them, Lamotrigine and Levetiracetam are the safer drugs. And remember, sodium valproate always, better to avoid in all reproductive age group women. So usually all young girls, even in India, I think from the age of 14 itself, we should avoid giving anti-epileptic drugs. I call valproic acid is a very good drug, especially for in neurology practice, but it's not a good drug for women because it causes so many problems. It causes weight gain, hair loss, it can cause teratogenicity, it can cause delayed periods, and so many things it can cause. So somehow it is an anti-woman drug. It causes so many problems. Even in migraine also, it is very helpful, but still it's not a good drug for women. So the commonest drugs which we can safely give is, one is Levetiracetam, other one is Lamotrigine. Of course, after Levetiracetam has come into the market, life has become easy to the doctors. Of course, Lamotrigine is one of the safest drugs. The problem is 10% risk of rash is there, and this drug should be titrated very slowly. And remember, one thing is, when you are giving any patient who is on anti-epileptic drugs who becomes pregnant, please don't change the medication. That is important, because by the time we know that the patient is pregnant already on drugs, that embryogenesis time is already over. Suppose if the patient is on over dosages, maybe you can talk to them, interact, see how they are, and then slowly adjust the dosage. That is the take-home message I should tell you, all of you. And regarding emergency LS, in any patient who has status epilepticus, there is no role of LSAs in all epileptic patients unless the patient is in status epilepticus. Better you can always proceed with a safe vaginal delivery. And one thing is, pethidine should never be used because it is metabolized to norpethidine, which is an epileptogenic. So always during labor and delivery, the drugs, we routinely treat the patient with this benzodiazepines, lorazepam or diazepam. Only thing is, you have to monitor the fetus and the mother also, because sometimes they can have respiratory depression. So role of vitamin K. So now the life has become easy because of newer anti-epileptic drugs which they don't interact in the liver. All babies born to women who are taking enzyme-inducing drugs like previous drugs like eptoin, phenobarbital, carbamazepine, those drugs, they should be definitely given intramuscular vitamin K. So previously, when we did our this one degree, they used to say that to give to the mother also, but that is, that is not a compulsion, because there's a lot of, they may not be much useful, but giving to the baby who is on enzyme-inducing drugs, which I already told, that really helps him. And coming to the postpartum care, and most of the times after delivery, This is one part where they neglect. Within 1 week, we should always titrate the medications, because the drugs which are increased during pregnancy, sometimes they can cause toxicity after delivery. So, and the other thing which is neglected is, and most of the women are afraid, is whether they can give breastfeeding. Yes, breastfeeding can be given. So all the women who is on anti-epileptic drugs, they can give anti-epileptic drugs. Only one warning what we have to tell them is, see the baby, whether the baby is feeling drowsy or if the baby is developing a rash. This is the fundamental statement where you can tell them that you can feed the baby, but at the same time observe the baby. That is the most important thing you can see. So actually, to say, in epilepsy, there is no ideal anti-epileptic drug. So now, as the data says, though Levetiracetam and Lamotrigine, they say it is a safer drug, probably after 10 years, somebody will publish a paper telling that this also has some problems. So always stick to, controlling seizures is the most important one. Second thing is, monotherapy is better, and also better keep the safest dose rather than overdose or avoid, higher dose, and avoid valproic acid. But don't stop valproic acid if the patient is already on that drug. That is most important. And in preconception itself, all epileptic women, starting from before marriage also, start folic acid, and that's what we do in the OPDs.